Good afternoon, I'm Nadiah Abdul Latif and you're watching The Nation on Bernama. Today we're spotlighting a hidden but urgent issue, period poverty. A new Suhakam report finds that 1 in 3 girls have missed schools and up to 20% faced period poverty. And for low-income families, pads alone can take up to 7% of monthly income. With us today is Dr. FATIMAH ALZAHRAH from IIUM to share insights on building a dignified menstruation for all. Welcome, Doctor. Thank you very much for joining us today.
Thank you, Nadiah.
And when we were talking about the Suhakam report that came out in August, there's a lot of things to unpack here. First and foremost, perhaps the misconception that menstruation is purely a female or a women's issue. And on top of that, the issue of just girls and school-going children. So I want to head straight into this. I mean, you've studied the intersection of gender, social inequality, and Suhakam's report calls for ending of period poverty as a human rights issue, not just purely a gender-lensed issue, right? And earlier we spoke about the fact that menstruation affects not only girls, but also women in their older ages. We're talking about menopause. We're also talking about women in incarceration, refugee women, persons with disability. So please, let us know, in terms of framing the importance of this issue, what does it take to change in terms of policy and action on the ground, and of course, public attitude?
All right, so thank you so much, Nadiah. I'm so excited that the report is launched. I think shout out to Sahana, who actually worked on the report. This report is monumental actually because it's our first national level report on period poverty. It also provides a framing of what period poverty is and a more comprehensive definition of period poverty. And just like you said, it also reminds us that menstruation does not only relate to girls or school-going children, but when we talk about menstruation, we're talking about half the population experiencing something on a monthly basis generally for 30 or 40 years of our lives. So it's a really significant phenomena, significant part of our lives of half of the population. And also to add, every human being that has ever existed came from the cycle of menstruation. So it is a very significant part of human life. So it's something for us to think about in a deep way and also to understand the gravity of it. And at the same time, recognizing that women and girls go through different phases of our lives where we have different needs and different understandings of things. And at the same time, even though we might be in the same age group, we may be experiencing life totally differently because maybe some of us, maybe in a time period, we're all going through, for example, the flood.
Yes.
So during flood times, what do we need? And then there's also some groups of women who may be refugees or persons with disability. So there will be different needs. So what the report does actually is to think about menstruation as part of our human rights.
Right.
And so when we move it away from welfare, then we secure a guaranteed right for all menstruators in ensuring that it doesn't stop us from accessing life in general.
That's such a brilliant and important point. I mean, we very rarely think about, you know, what happens when you are a menstruator in a situation of crisis or in a situation of disaster. In fact, every end of the year, I just came through flood, right?
Yes.
So I'm just imagining what it would have been like for women who are at relief centers. You know, we're lucky to not have issues of war, issues of famine, but in cases with deep conflict, that would be even far worse, I would expect. Now, what exactly is the magnitude? What's the widespread issue if we're talking about period poverty in Malaysia? How bad is it?
All right, so I think once we understand that period poverty is not just not having pads, right?
It's not just about the products.
Yes, yes. And it's not just people who cannot afford pads because they don't have money. It's also thinking about the framing of having a dignified menstruation.
Yes.
Right? So what would that mean? Having access to clean water, having access to education about menstruation, access to diagnosis and treatment relating to menstruation, and all the things related to being able to go through it in a dignified way, including privacy, not being discriminated, not being teased, for example, or bullied around menstrual issues. So when we think about that, then we can see then, okay, there may be different issues with different severity. So we have very severe cases where we've heard women who choose to starve themselves.
Yes.
to fast, not because of religious issue, but because they don't want to have their periods next month.
To stop
Yes.
menstruation, yes.
Or choosing to be pregnant instead of having menstruation. And a lot of people might not understand this because we don't experience poverty at that level of thinking about what to do tomorrow. So
Yes.
that's like really extreme cases. And of course, then we have on the broader context of things. Do we all have clear, correct, appropriate knowledge about menstruation? So that would be maybe like most of us might not have proper education about things, or access to healthcare, or for example, policies relating to that. So it can be as extreme on one end, or it could be affecting the majority of us, but in a, maybe we would say, like a lighter kind of way.
I think even for the general population, most people don't even talk about it. Households just talk about it when perhaps the first day you get your menstruation, and you usually outsource that responsibility to a mother,
Yes.
or the significant other in the family that potentially is the female significant
but
other.
you know what's really interesting is that yes, maybe traditionally we would think the first resource person is the mother, and I think this is really important for mothers to know. In our recent research, we found that it's no longer mothers who are the first resource person for
That's
children
wonderful.
today.
And where would that be? Is it chat?
It's yes.
Wow, really?
So for a long time, maybe in the history of human being, that we would always go back to our mothers, and mothers would be the first resource person. But children nowadays don't depend on their mothers. So if we don't play a role, then we don't know what our children are learning about menstruation.
This signals a really, really big point.
Yes.
If young girls, and including young boys, are going to chat to find the next best thing or information about what do I do if this is my first day of menstruation, I suppose the understanding of that would be there's privacy. I can ask for information without having to be judged or having to go into that uncomfortable conversation, because you know that there's that arm's length of chat, not necessarily being a person. But that really actually changes the dynamics of families and how this very important conversation is being had. Doctor, I want to pull you back. When we're talking about the recent study, we know that there was a recent study that suggests that up to 1/3 of students miss school due to inadequate menstrual management. What does menstrual management mean? And then this community research also talks about the fact that 16 to 20% of girls experiencing period poverty also, have issues with school and everything else. Could you kind of tell us what this means in terms of scale, reliability, and what this signals?
So I think when we think about school children, maybe some of these studies look at specific areas, and yes, we have looked at some areas where it's really severe. So for example, in the case of Sabah, for example, there's been higher reports of girls not attending school because of menstruation, and I think I want to applaud KPM for their recent initiative of Gadis, which is actually to highlight the issue of period poverty. So there are some states and areas where we would have higher ratio or higher percentages of girls who don't attend school because of menstrual management issues. So this relates to having access to products. It might also relate to toilets, whether the school toilet is able to cater to the children. And then of course it has to do also with parents and teachers. So in some contexts, if girls don't go to school, the parents are alarmed because you should be in school, you shouldn't be at home. But there are contexts also where parents may be not educated or do not put priority to education of girls. So if the girls don't go to school, it's okay. We save up some money. Instead of buying you pets, you can stay at home. So this kind of thinking really affects these numbers. So it's not just about the product. It's also about an understanding about the importance of education for girls in the context of school.
It's so important when you read through the report. I think it brought home the point that this is an issue that's so interrelated and so inalienable with so many other rights. You said right to, for example, toilets and clean water, and how we take that for granted in places like Malaysia where water is abundant. We don't even think for a second that this is going to be a big issue for communities that may not have access to clean water if monthly menstruation happens, right? And then at the same time, if education was never a priority in your household, then that's an easy thing. Don't have to go to school this month because you said that it could be cramps, it could be having inaccess to products and things like that. But there's also the risk too.
Also, actually, just leaking issue actually is an easily solvable issue to have extra clothes at school. But sometimes girls get sent home, and it's like everybody accepts it. Like, okay, you can come home because you had a leak. Yeah.
Right. It's also the issue of understanding when you're talking about menstrual management, you're also talking about how to have positive conversation about things like this, right? Instead of demonizing the situation or be embarrassed over a situation. I mean, if you're in an all-girls school, it's one thing. If you're in a co-ed school and you've never had this conversation, I'm guessing this intrinsic, very early on experience actually then shapes everything else that comes after. And we're talking about 60 to 84 days per year of potential dropout for some of these students. And then you're wondering why we've got girls who are not finishing school. Now let's talk about the health impact. The research also talks about 76% of adolescent girls report painful menstruation, yet less than 15% actually seek medical help. Is this because they think that it's normal, or what are some of the causes for this?
So this relates to the idea of the gender pain gap. So shout out to Dr. Hana Nazri, who's doing some work on this as well. So oftentimes culturally we believe that it's just gugut, or it's just like period cramps. So, or there's also some form of discrimination that happens with girls or women who experience pain during menstruation, that even among women ourselves sometimes we don't take those pains seriously. And so this is not just happening among the public, but we also see this in terms of the advancement of our research on health related to menstruation. So on endometriosis and the diagnosis, and whether our healthcare personnel are trained to diagnose, so sometimes we get reports from women and girls who've gone to doctors to tell them I'm in pain, but they just get sent home, like this is just a regular...
Or you're told to just suck it up, right? Right, and since you're talking about health impacts, a lot of people don't necessarily talk about other issues relating to women's health, and this can also include, like you mentioned, endometriosis. It could be PCOS. For rare disease communities like the women that we serve, you've also got Mayer-Rokitansky-Kuster, where women are actually born with incomplete wombs or vaginal tracts, and that actually does affect menstruation. So here, when you're talking about this report doesn't only talk about when you menstruate, it also talks about when you're going to stop menstruating or when you don't menstruate at all. Now, why is it important to understand that these are actually not the same things?
I think when we think about the comprehensiveness of the issue, we want to address not just one aspect of it. And I think that's why things don't get solved in the, based on what we've done. Actually, Malaysia's done quite a bit. We removed the pink tax very early on. We're one of the first nations to do that. We have quite advanced healthcare, or we provide a lot of resources for our people generally. But somehow an issue this big has not been addressed properly, maybe because of the framing of things. So that's why it's really important to recognize how big the issue is. And the report is not the final version of what it should be, but it starts the conversation, and that's the point. It's for us to pick it up and interact with it and extend it when it's needed.
You mentioned something very important. You said things are not solved, and essentially I'm going to extend that. Things are not solved when we're looking at it in parts instead of as a whole. And to really understand the gravity of the situation, I suppose we need to kind of zoom out and look at it in terms of policy and in terms of budgetary constraints, and how much political will is being put into to solve this issue, which, to your point, is very solvable. So Suhakam urges a systemic and budgeted intervention to solve this challenge. Now, from your perspective, how would ministries like the Ministry of Health, the Ministry of Education, the Ministry of Women, because I do see this as a multi-ministerial effort in combating and tackling some of the issues that are pressing but actually solvable?
Yes, some of these things are very solvable and could be done in like a single generation, and then we might not have to address it. But we know that things like poverty or period poverty is not something that we can completely eradicate totally. There will be upcoming issues, new things that change in the way that we do things, but generally many of the things that we experience now are addressable. For example, ensuring that girls can stay in school. So things like ensuring that every school has a menstrual kit or a sanitary kit, extra clothes for girls to change, and that teachers are educated. Boys and girls, not just girls, are also taught what to do in case there's a leakage, how to respectfully address these issues, mechanisms for reporting. So these are things that are doable maybe at the education side. On the healthcare side is training doctors and nurses, and also pushing a little bit more on research relating to that. And I think there's a lot more things that I won't be able to mention, but for example, looking into women in prison. right? Whether or not there's sufficient products for them, and things like that. So there are multiple ministries that would need to review, but this framework that the report provides gives a chance for different agencies to look into how does this affect the way that we work and how can we support this effort.
Your answers just gave me like 5 other questions of why I think this is a very important conversation. Now, we spoke about infrastructure, of course, wash facilities. What about things like curriculum? Is there a need? Because we usually see that as, you know, when the industry partner comes in to give that one day workshop with, you know, graphic design of cutesifying what sanitary pads are supposed to look like. But are we meant to be doing more than that?
Yes, I think we talked about this early on when we said that menstruation happens for a long time. For most women, it's 30 to 40 years of our lives. It's not always the same. That maybe one-off conversation shouldn't be the one-off conversation, whether it's between moms and girls. So just now we talked about avoiding that awkward conversation with moms.
Avoiding awkward conversation.
Let's use the chat. But actually, we want to because the comfort of, you know, parent and child or guardian and child relationship is really important for many things. So it's not just for periods, but so many other things that really helps, you know, mental health and connections in family. So we want that to be one platform. We don't want to, you know, scrap that and just put everything in the curriculum. So we definitely want many channels for children to learn about what to expect. So it should be age appropriate. So maybe when you're small, just to know that one day you'll probably go through menstruation and this is what it's going to be like. And then when you know, go through life, you want to understand changes that happens to you in your reproductive life or years, and then what to expect in menopause. And I think menopause is an even bigger conversation that hardly ever gets talked about. That needs a whole session in itself. Doctor, you mentioned some very important points. You said getting the men involved, and I want to also add on to that, right? When we're talking about getting men involved as champions, I do believe that employers also need to be able to understand. Very often we see this in HR departments where, you know, this particular lady is always off because she's complaining of period pain and things like that. Because as you said, this is a lifelong issue. So how do we get the boys and the men involved in understanding this? And when women are actually in the workplace, what sort of safeguards of conversations should actually be had to ensure that women continue to remain productive and not feel that they have to be either marginalized or mansplained into thinking this is actually a human right issue, not necessarily just a girl or a woman's issue. All right, so you got that right. I think the report framing it not as a welfare issue, but a human rights issue provides the first, you know, the first ground of things, that human beings are not just men, but also women, right? And that women might not experience the same things as men, and we have different capacities and different needs. So establishing that's really important, and then establishing that because we have different needs, we deserve to have dignified menstruation. So there are people who are responsible to ensure that this happens. You know, it's not just for us to keep fighting for ourselves, but people who have authority needs to take responsibility to ensure that this, you know, we can't expect children to fight for their rights to, you know, menstruation. But, you know, people who are in charge needs to do that. And by and large, in our society, men hold a lot of authority in a lot of spaces where they make decisions about women's bodies and women's lives, or girls' bodies and girls' lives. So the education of men is the most essential part of addressing period poverty as well. So we cannot just talk about, you know, a closed room where girls and women talk about period poverty or periods, but also a space where men are part of the conversation.
Which generally has been the situation, right? A lot of women's related issues and women's right related issues are spoken about in a whole hall filled of women, very rah-rah, all very excited, and then after they go back to the same system that they're in. Now, very briefly, I'm going to combine these two thoughts, right? We're talking about sustainability. We're talking about ensuring that action is actually met with the same amount of fervor and urgency on ground. So we know that there have been amazing CSOs, NGOs, social entrepreneurs that have gone into this space, especially in providing assistance and support and enablement for more vulnerable communities like women, refugee women, or stateless and undocumented women, or persons with disability, which hardly even get the conversation or the airspace to understand what does this mean as myself being a lady with disability and menstruating at the same time. So could you give us some thoughts? Does the report talk about why this systemic issue can actually be addressed through a whole systems approach?
So I think the report suggests first to look at Article 5. So I think that's the beginning of, things at least. And as I mentioned earlier, to also have a comprehensive idea of what period poverty and who's involved and, how it affects. But it also talks about, how as a country there are many groups of people who do different things to ensure that, we can meet the needs of different groups of people. So I think engaging with stakeholders is also important. We don't want to say that welfare initiatives, which has been done amazingly. And I think when we talk about period poverty, much of it is being upheld by, NGOs, CSOs, and also people who are just genuinely wanting to help and be a good community member. But at the same time, if it doesn't have any real structured change, then it will always be a welfare issue.
Definitely.
It wouldn't be an issue that we can address properly.
And I don't think that we're going to be able to address this using just purely a charity model, because clearly, this has got multi-dimensional elements that are actually interplaying with each other. Now, before we close, I wanted to ask you, in terms of ASEAN and the comparison of where Malaysia is compared to other states in ASEAN, looking across ASEAN, where do you see Malaysia stand? What are perhaps some of the things that we can learn from other countries that are in the region that perhaps have managed to tackle, low resource settings very well?
I think we can look at some of our neighbors who've started or initiated leave policies for menstrual pain. And I know that this can be quite a controversial issue, but we need to understand also that when we want to introduce something like this, it must be an end-to-end kind of initiative. We cannot, I can totally understand why we don't just tell employers, you need to give leave for menstrual pain and then leave them to manage that. And of course, that will create bigger problems for women in terms of discrimination and things like that. So we can look at our neighbors, like Philippines, who have already introduced menstrual leave and see what works, and what can we learn from them. So we can sort of look around us and see what's available. But I think Malaysia is quite ahead in a lot of ways. So we should leverage on our current chairmanship at ASEAN to bring up this issue and see what can we learn from each other and what can we do together.
Definitely. I love this conversation that I'm having with you, and I think you've just unpacked just the tip of the iceberg of the amount of things that we can actually discuss if we're talking about human rights and dignity, and of course menstruating with dignity. In fact, you've taught me a new term here, menstruators. Yes. I wouldn't have called that as a term. So thank you so much, Doctor, for joining us today. We know that period dignity is not just a side issue. It involves education, it involves health, it's an economic issue, and of course it touches every family, every individual that's living in Malaysia. Now the numbers of course tell the story. Girls are losing their education, some are not being able to go to school, families are having to spend a chunk of their income on products which may actually be made more sustainable if we're looking at how local understanding can actually support some of these efforts. Of course, many young women and women who are aging are also suffering quietly. So solutions do exist. We need political will, we need policy level discussions, we need budget, and of course we need a whole society and a whole systems approach. Thank you so much for joining us today. Now let's continue that conversation, because period dignity is dignity for all. Thank you for joining us.